Hi, I'm Dr. Elsa Pichardo. I'm board certified in general surgery and fellowship trained in hepatobiliary and pancreas surgery. I'm a surgeon on the medical staff of Penn Medicine, Princeton Health. Today, I'm going to discuss pancreatic cancer, including symptoms and risk factors for the disease, as well as diagnosis and treatment options. According to the American Cancer Society, the risk of developing pancreatic cancer increases as people age. Almost all patients are older than 45, and the average age at the time of diagnosis is 70. The disease is somewhat more common in men than women, and there is a higher incidence of pancreatic cancer among African Americans. Risk factors for pancreatic cancer rise after age 50 and can include a history of smoking, diabetes, a history of chronic pancreatitis, and a family history of pancreatic cancer. While the risk is low, the gene for pancreatic cancer can be inherited. If at least two of your first-degree relatives, that is a parent or sibling, have had pancreatic cancer, you should discuss this with your primary care physician and consider genetic testing. There often are no clear signs that someone has pancreatic cancer, which is why it's so important to talk to your doctor about changes in your health. People with pancreatic cancer may experience abdominal or mid-back pain, nausea, vomiting, and an unexplained weight loss, a burning feeling in the stomach, inability to digest fatty foods, which can result in large, greasy stools, and jaundice, a yellowing of the skin or the whites of the eyes, which can be caused when a tumor blocks the bile duct. According to the American Cancer Society, there are steps that everyone can take to lower their risk of developing pancreatic cancer. Don't smoke. Eat a healthy diet, which means avoiding processed foods and red meats and sugary drinks. Limit alcohol use. Maintain a healthy weight and stay physically active. Unlike some other types of cancers, there's no single diagnostic test that can tell you if you have pancreatic cancer. Definitive diagnosis requires a series of imaging scans, blood tests, and biopsy, and those tests are typically only done if you have symptoms. Often, a cyst or tumor is discovered during an unrelated CAT scan for another condition, and then the patient is referred for further testing. It is important to remember that not all cysts are cancerous. In some cases, your doctor may just need to monitor the cyst for changes rather than take surgical measures. Treatment for pancreatic cancer depends on the stage and location of the cancer, as well as on your overall health and personal preference. When the cancer is found at a later stage, treatment becomes more complex. When the disease is detected at a less advanced stage, surgery, chemotherapy, and sometimes radiation can be effective. When surgery is needed, depending on the location within the pancreas, it may be able to be done laparoscopically, sometimes robotically. Surgery may not be an option if the tumor is large. In that case, chemotherapy may be used to reduce the tumor enough to allow for a surgical procedure. From diagnosis through recovery, Princeton Cancer Center at Princeton Medical Center provides a multidisciplinary approach to care for patients with pancreatic cancer. And as part of Penn Medicine, our experts work with the teams at Abramson Cancer Center, a world leader in cancer research, patient care, and education. If you have any of the symptoms or risk factors that I described, it's important that you make an appointment to speak with your primary care physician so that they can order the necessary tests and make a proper diagnosis.